Birdman, hanging out here at Summit Healthcare for Summit Healthcare's. I've got with me, of course, Angie Fabian. How are you?
I'm good. How are you?
So we're going to do an update on what's happening here at Summit Healthcare.
Yes, we are.
Now, I want to make sure everybody understands this is all of Summit Healthcare whenever you're talking about cases and stuff.
All of Summit Healthcare, any clinic that is associated with Summit Healthcare. So that would be the hospital, of course, the outpatient pavilion, the surgery center, Sholo, Summit Healthcare Family Medicine in Sholo, the urgent care in Sholo. Same with Pine Top, Bison in Heber, Holbrook, Snowflake Taylor, Snowflake Family Medicine, Eager, and St. John's.
Okay. When we're talking about cases, we're not talking about any other walk-in clinics that are not Summit, any
That is
other
correct.
doctors that are not Summit.
That is
They
correct.
have their own separate set of
They
data.
have their own separate set of data, so we're just talking about Summit.
Okay, so what and how many cases do you have? Where are we at right now?
Right now, we have no positive confirmed cases of COVID-19 at any of our Summit Healthcare facilities.
Okay, can you tell me how many you've done overall?
Yes, I have to
testing-wise?
look at my notes, sorry.
That's fine.
Okay, so to date, we have done, where's my notes here? Oh, it's not here. Crap. We have done we have submitted 97 cases,
Okay,
and we have about 50 of them, 50 plus that came back,
okay,
and we're still waiting for 35 of them.
okay.
We have 35 pending cases.
And no positives, obviously?
No positives as of yet, yes.
Okay, and the rest of those are all
Yes.
obviously negative. So there you go.
Obviously negative,
Okay, cool.
yes.
Okay, for the cases coming back negative, what else does the patient possibly, because obviously they have something you're testing for.
Yes, so patients who come into the hospital, if they are suffering with respiratory, hard time breathing, a fever of 100.4 or more, and just regular not feeling well, things like that, they could have the flu, they could have a cold, they could also have pneumonia, RSV, and we've seen an uptick in, I have to pronounce this out because it's a word that I have, human metapneumovirus,
Oh, wow.
which
Okay.
we've seen a lot of. But they're all being tested for those when they come in along with COVID-19 because the symptoms are similar.
Okay.
So when the COVID-19 comes back negative, the patient may have one of those other conditions.
Okay. Who are you in contact with as far as everything that's going on and who you've been communicating with?
I work closely with Jeff Lee at Navajo County Public Health.
Okay.
And they keep us pretty informed and we keep them informed of what's happening.
Okay.
So you mentioned earlier about testing patients.
Yes.
So like Rob mentioned earlier, we're not the only facility up here that tests patients. So if there's a positive in Sholo or somewhere else in our community, that patient did not come to Summit. They were tested somewhere else, and we're not aware of those positives. We're not given that information.
Now, when you're doing the testing isn't done here at the hospital, and I don't even think the labs are up here, are they, or are they?
No. So we take the sample, we do the screen, and then we send it out. And it takes right now, in the very beginning, it was taking a while to get the results back. Now we're looking at anywhere from 3 to 5 days.
Okay.
And that doesn't include weekends. So we're looking at business days.
Okay, we're talking about stopping the spread, and that's why there's this stay-at-home order. And
Yep.
that's to get the people to stop the spread of this. It's airborne, so almost at some point everybody's gonna get exposed to it.
Exactly.
You can't avoid it, really. Can
You can't avoid it. You're
Okay.
going to be exposed to it at some point.
If we get a huge amount of exposure, a lot of people get exposed to it. Is Summit prepared to handle that?
We are prepared.
Okay.
We are doing test kits because you have to remember if I get it, I may just have a fever and hard time breathing, but I may not need to be here as an inpatient in the hospital. I can be sent home like most people are on self-quarantine.
Right.
So we are prepared to treat our community when this breaks out.
Okay, can you tell us some of the things that are going on that are going to be happening that people will see here?
Yes. So by the end of this week, we are putting up a tent. We call it our emergency preparedness tent.
Okay.
Out in front of the emergency room where the canopy is, you'll see a tent. Now that's going to be our triage tent. So what will happen is a patient will drive in to go to the emergency room. They will meet with a nurse, a care provider right there to get triaged. And then once you park your car, you'll be told, okay, you have respiratory issues, you're going to go this way. You have non-respiratory issues, you're going to go this way.
Okay.
And for any mothers to be out there, If you come in, because our main hospital doors close at and lock at 6 now during this epidemic, you'll go to the emergency room and you'll be told you'll go through the clean area. You won't be exposed to respiratory issues. You'll go through the other area, and somebody from OB will come down and get you.
Okay, so this isn't going to impact the emergency room or ambulances getting in or anything
Nope,
like that?
the ambulances still have their own ambulance bay. Emergencies still come in.
Okay, so we had a list of questions.
Yes, we did.
Hit them all. We talked about telemedicine services.
Yes, so look shortly, watch for, we'll be putting out our healthcare providers, Summit Healthcare providers are implementing telemedicine. We have summitcares.net. This is totally different. This is where you can meet with your healthcare provider via telemedicine.
Okay.
So if you have a cold, a flu, allergies, need to talk to your provider about another issue or prescription refill, you'll just call the call center at 537-6700 and they'll schedule you for a telemedicine visit.
Very good. Anything else that we need to make sure we cover?
The admin building here is close to the public. We only let certain visitors in and we screen them to make sure they're okay. But yes, it is close to the public. All of our buildings except for the outpatient pavilion and the hospital are closed. There's no visitors still at the hospital at all. So you can't come in and visit, you can't come in and get lunch. You have to be there as a patient for an appointment, or if you're a care provider helping with a mom who's in labor or somebody with special needs or a chronic issue, you can only one visitor per day.
You gotta say, I've probably taken my temperature more in the last couple of weeks than I have in my entire life. I'm at least closing in on that average.
Right? Exactly,
Awesome.
exactly.
Anything else, Angie?
Not that I can think of, but things change around here with this virus hourly.
Okay, so stay tuned, of course, on Summit Healthcare. They have the updates that you can get via text messaging. You can go to their Facebook page. You can go to the website as well, which is summithealthcare.net. I'm on Birdman Media, obviously keeping up with everything that we've got going on with a daily update. We'll let you know as soon as we know anything officially, getting it from official sources, what's going on. So make sure that the rumor mill, you stick to the actual official data.
Yeah, exactly.
Stay at home. Stay at home, stay at home, stay healthy, and stay connected with people so that you don't get bummed out, but not so much on the social media side. So,
Don't believe everything you read on social media.
awesome. Thank you very much, Angie.
Thank you.
That's going to be it for this episode of Summit Healthcare's. I'm Birdman, and wash your hands.